Good evening, and welcome to the public hearing of Columbus City Council's Health and Human Services Committee. I am Councilmember Priscilla Tyson, Chair of the Health and Human Services Committee. Before getting started, I want to make everyone aware that this hearing is being recorded for rebroadcast on CTV, Columbus's Government Channel 3. The rebroadcast schedule is available at www.columbus.gov. The topic of this evening's hearing, is Minority Health Month, which occurs in April. This month allows us to highlight and discuss the health disparities among particular groups of residents in our community, the services available to these groups, and the city's ongoing efforts to address these disparities to enhance overall health equity in the city of Columbus. Before we begin, I would like to explain to our viewing audience the origins of the Minority Health Month and why it has become such a critical time for our community. Created in 1989, Minority Health Month is an annual campaign which focuses on health awareness and disease prevention in minority communities. In short, the 5 goals of minority health are to provide crucial information for individuals to practice disease prevention, to promote healthy and active lifestyles, to showcase the resources for and providers of grassroots health care and information, to bring attention to the desperate health conditions between Ohio's minority and non-minority populations, and to gain support for ongoing efforts to improve minority health year-round. Central to this mission and the message of Minority Health Month is the fact that certain groups can carry a disproportionate burden with regard to incidence, prevalence, and mortality of certain diseases and health conditions. These are commonly referred to as health disparities. Health disparities are not limited to any single disease or health condition and are both measured and monitored through the use of public health data. Most health disparities affect groups that are marginalized due to their socioeconomic status, race, ethnicity, sexual orientation, gender, disability status, geographic location, or some combination of these factors. Individuals in minority populations tend to have limited access to resources that many of us take for granted, such as healthy foods, reliable and secure housing, and a quality education, safe neighborhoods, and freedom from racism and other forms of discrimination. The purpose of this evening's hearing is to learn more about the illnesses and social determinants that disproportionately impact minority communities, as well as review some of the programs and services that Columbus Public Health is pursuing to fulfill its mission to address the health disparities that exist in our community. We will have 2 presenters this evening. Ryan Johnson, the Program Director at the Columbus Office of Minority Health, and Angela Dawson, the Executive Director of the Ohio Commission on Minority Health, and I'm sure she will state that we were the first state in the United States to have an Office of Minority Health in any state, which is at the state level department focused on reducing health disparities among minorities. And I also want to recognize Councilmember Shannon Hardin, who has joined us this evening. So welcome and thank you for being here, Councilmember Hardin. And I would now like to turn it over to Ryan Johnson to make his presentation.
Good evening. On behalf of my colleagues that are here this evening and the ones that are sitting in the back, thank you for the opportunity to have a conversation focused on minority health and its issues impacting our community. Thank you for the opportunity to discuss the wonderful work of Columbus Public Health and our dedicated staff. Columbus Public Health is charged with ensuring conditions in which people can and will be healthy. During our time together this evening, we will discuss what specific minority health disparities exist here in Columbus, Franklin County, what factors that contribute to these disparities, what specific things Columbus Public Health has done and is doing to ultimately help to reduce these disparities and improve health equity. The mission of Columbus Public Health is to protect health and improve lives in our community. We are the leader for identifying public health priorities and mobilizing resources and community partnerships to address them. Columbus Public Health focuses on factors and conditions known to impact health and disease. The environment in which you live, learn, work, and play impacts your health. Columbus Public Health has strategic priorities which are aligned with established departmental goals: reducing infant mortality, reducing overweight and obesity, reducing the spread of infectious disease, improving access to public health care, implement departmental reorganization. Columbus Public Health is made up of a range of programs providing clinical, environmental, health promotion, and population-based services. The department has an annual budget of approximately $46 million and is staffed by approximately 500 full and part-time employees. Columbus Public Health has a rich history of helping people live healthier and safer lives, promoting social justice, and serving the underserved, so we definitely care. We're responsible for maintaining the public's trust through credible information, quality programming and services, and fiscal integrity. Credible science is the foundation of our policies and program decisions. I would like to touch upon the social determinants of health, as they are factors that influence a person's quality of life. Social determinants of health have both structural and intermediary factors. Not everyone in Columbus has the same opportunities to be healthy. We see differences in health based on race, ethnicity, sex, neighborhood, income, education, sexual orientation, and other factors. Health inequities are differences in health statuses and death rates across these population groups. The differences are systematic, avoidable, unfair, unjust, and are sustained over time and beyond the control of individuals. Health inequities have roots in unequal access or exposure to the social determinants of health, which are education, health care, healthy living, and working conditions. Racial and ethnic populations are disproportionately represented in low-income neighborhoods with fewer educational opportunities, which result in poor health status and health outcomes. Research has shown that the social determinants of health have a greater impact on your health than genetics or access to care. Based upon the results of a 2011 assessment, Columbus Public Health created a multi-year health equity plan, and this was our effort to institutionalize our commitment to address health inequities, to align human resource practices to support health equities, to educate staff about health inequities and their root causes. Beginning in September of 2014, the Diversity and Equity Committee began recruitment of committee members and selection. The first meeting began in June of 2014. The goals of the Diversity and Equity Committee were to create a health equity statement, talking points, and training required for all CPH employees. And all of these documents are currently under review by our senior leadership. Columbus Public Health, like many public health departments around the country, is working to address the root causes of health inequities and create opportunities for all people to be healthy. Our work began in 2000 when we established the Office of Minority Health to focus on reducing racial and ethnic disparities. And this was before funding was available from the Ohio Commission on Minority Health. The Office of Minority Health is actually located within the Neighborhood Health Division of Columbus Public Health. And again, my name is Ryan E. Johnson. I am the Program Director of the Office of Minority Health at Columbus Public Health. In 2008, CPH organized a series of community forums focused on the documentary series Unnatural Causes: Is Inequality Making Us Sick?, which examined the impacts of racial and socioeconomic inequalities on health. I would like to thank City Council and Councilmember Tyson for the continued commitment and support of Columbus Public Health and the Office of Minority Health. In addition to the funding that we receive from the Ohio Commission on Minority Health, Your advocacy for general fund dollars allows this office and dedicated staff that you see here to continue targeted programming and collaborative efforts. It's because of these general fund dollars that we're able to have an Office of Minority Health, which is a program director, and 3 program managers, one of which was recently hired and began work on April 13th. As you can see from this slide, 2 Program Manager 1 positions and 1 Program Manager 2 position is funded entirely by the CPH General Fund. So 80% of the funding for the Office of Minority Health is from the General Fund, which is roughly about $210,000. The Ohio Commission on Minority Health provides about 20%, which estimates to be about $42,500. In 1985, the U.S. Department of Health and Human Services issued the Secretary's Task Force Report on Black and Minority Health. The report, it clearly established that differences in health status existed between the majority and minority populations here in the United States. The minority population was defined as African American, Latino Hispanic American, Asian Americans, Native American Indian. I invite you to join me and members of our team in participating in a webinar to celebrate the 30-year landmark of Margaret Heckler's report on Black and minority health. The webinar will be held on Friday, April 24th from 2:30 to 4. And it'll trace Ohio and Michigan's effort to eliminate health disparities and promote health equity. Some of the presenters: Charlita B. Tavares, Executive Officer, Columbus Neighborhood Health Center; former State Senator and Representative Ray Miller, Ohio General Assembly; Othelia Pryor, Michigan Minority Health Commission; Cheryl Ware, Michigan Department of Community Health. These next few slides will address the specific health disparities that exist in Columbus and Franklin County. So this gets at the minority health disparities. As far as chronic disease and health behaviors, non-Hispanic African Americans compared to non-Hispanic whites are almost 2 times more likely to be current smokers, 1.4 times more likely to be obese, 1.2 times more likely to be diagnosed with diabetes, asthma, or high blood pressure. As far as infectious disease, African American males are disproportionately affected by sexually transmitted infections, demonstrating the highest incident rates of gonorrhea, chlamydia, HIV, are 9 times more likely than whites to have gonorrhea, 6 times more likely to have chlamydia, 7 times more likely to have TB, and 3 times more likely to be newly diagnosed with HIV. In addition to having higher rates of diabetes, blood pressure, and obesity, non-Hispanic African Americans are also more likely than non-Hispanic whites to die from diabetes, chronic disease, and stroke, which may be the result of chronic disease or other health behaviors. So as far as mortality is concerned, 2 times more likely to die from diabetes, over 6 times more likely to die due to a homicide, 2 times more likely to die from chronic kidney disease, 3 times more likely to die from HIV, and if we're talking infant mortality, the rate among non-Hispanic African American women is almost 2 times that of non-Hispanic whites. The Office of Minority Health has an important responsibility in leading efforts to educate citizens and professionals on imperative health care issues, and this is achieved through our 4 core competencies listed on this slide. The duration of this presentation will focus on specific programming Columbus Public Health has done and are doing to move the needle forward to ultimately reduce these disparities I've mentioned. So again, this gets at what we're doing to address health disparities in our community. The Office of Minority Health will serve as a mechanism for local governments to produce consistent data sets representative of the diversity here in Columbus, Ohio, and will also provide a local presence for issues on minority health. The Office of Minority Health will institutionalize the efforts to eliminate health disparities, will serve as a conduit of information trends and emerging concerns between the Commission on Minority Health, Columbus Public Health, and our local community partners. Community forums are coordinated by our office to provide Columbus residents education on a variety of health issues tailored to specific communities. The goal of these monthly forums is very simple: to empower key organizations, religious, and community leaders. So our office links individuals to healthcare resources, and our office establishes dialogue with leaders and members to share their views about health and healthcare needs. A special thank you goes to Jesus Avalle and Hebrew Noir, who are sitting in the back. They're my Columbus Public Health staff who have worked tirelessly to coordinate these initiatives for our residents, covering a variety of the health topics that are listed on this slide. PSE, or Policy, Systems, and Environmental Trainings, was focused on capacity building. Now, I'll touch on this in further detail later on in the slides. Cultural humility, training, understanding the worldview of cultures and how it impacts health. Substance abuse in the African American community in partnership with the Westside Community Health Advisory Committee. Thinking past race, expanding the definition of minority and moving forward to a place of full inclusion. These are all the things that we did relative to trainings and community conversations. We will work in partnership with the Columbus Local Health Advisory Committees. Community health advisory committees work with the neighborhoods to address their specific health issues and helping them to create awareness about these issues. The Office of Minority Health Advisory Committee is charged with setting up opportunities within the community to address issues surrounding minority health. So that includes access, data collection and survey development, knowledge of access to funding and grant opportunities, facilitating collaborative relationships. As a matter of fact, we have over 40 agencies that represent our Minority Health Advisory Committee, and we act as a sounding board. The Office of Minority Health participates and facilitates policy change initiatives. So what does that mean? Our office is currently in the process of offering multiple PSE trainings for community partners, and through these trainings, our partners will increase their capacity and skill sets to engage their constituents and colleagues more effectively as it relates to minority health and health equity issues. They'll increase their capacity to engage in strategic conversations, and they'll build relationships among advisory council members to support future work. The next scheduled PSE training is going to be on April 23rd and is hosted at Columbus Public Health. Listed above are some of the minority health accomplishments this past year, and that includes trainings, community presentations, forums, outreach initiatives, interpretation and translation. So next, I would like to highlight a few CPH programs that are focused on improving the health of residents and reducing these existing gaps. The Office of Minority Health is part of Columbus Public Health and is partnering with these programs in addressing racial and ethnic health disparities. The Office of Minority Health partnered with multiple agencies and community members to coordinate the Somali Health and Wellness Fair held in May of 2014. It was a 4-hour event held at the Global Mall, and it's actually a Somali shopping mall, and more than 300 residents participated. It hosted over 23 vendors from the local area that provide a wide array of health information, education, and health screenings. The next scheduled event is going to be on May the 16th, and we are currently conducting weekly planning meetings with our community partners. The Office of Minority Health at Columbus Public Health is partnering with the Ohio Hispanic Coalition to host the Mexican Consulate at Columbus Public Health. We coordinated local partners to provide health screenings and health resources to community members, realizing the opportunity of having that captive audience. So event planning for 2015 is well underway. The event will actually be on April 25th and April 26th, and then we'll host them again in October on October 3rd. The African American Male Wellness Walk is an annual event and walk aimed at raising awareness of men's health. Columbus Public Health is currently assisting with planning the upcoming walk, which will be on August the 8th. CPH provides a wide variety of services at the walk, including screenings, our own walking team, and health information. In 2014, there were well over 10,000 participants. In addition to the walk, Columbus Public Health is hosting several events which are focused on mental health. Ebola. Beginning in October of 2014, Columbus Public Health, the Office of Minority Health, began outreach and education on Ebola. We provided 7 community presentations and forums on Ebola to faith-based organizations, community groups, social service agencies, and medical practices. Through these presentations and forums, over 300 community members and professionals were educated on Ebola and how Columbus Public Health is assisting the West African community in Columbus. The Office of Minority Health has continued to explore outreach with other identity groups, focusing on the LGBTQ community. Suicide. As far as high school youth are 3 times more likely to commit suicide than heterosexual students. Homeless. In some major cities, LGBTQ youth make up 40 to 60% of the homeless youth population. Breast and cervical cancer. New research showing increase in the last stage of cancer for lesbian women. HIV. Gay men still make up 60% of new infections. Obesity. Seeing increased rates among African American lesbian women. Alcoholism and tobacco use. High rates of AOD addiction. A Toledo study that found that 80% of the LGBTQ youth had smoked cigarettes at some point in their life. Mental health challenges. Because of the stigma and rejection from families' mental health challenges increases dramatically among the LGBTQ population. Celebrate One. It's an initiative aimed at addressing infant mortality in 8 targeted areas within Columbus by aligning resources to improve socioeconomic conditions. In 2015, Phase 1 of this initiative has begun in 3 of the 8 targeted neighborhoods: the Near East, the Near South Livingston area, and South Linden. The Southside zip codes of 43206 and 43207 have an infant mortality rate that is over twice as high as that for some Franklin County suburbs. As a result, Columbus is partnering with 8 other Ohio communities, the Ohio Department of Health, and City Match to focus on improving birth outcomes and reducing racial disparities in infant mortality. The Cribs for Kid program started in July of 2014. To be eligible for the program, a person must be a woman who is at least 32 weeks pregnant, or a caregiver whose baby is 12 months old or less and weighs 30 pounds or less, eligible for or receiving WIC. A caregiver does not already have a safe seat place or crib, such as a bassinet or pack and play, they're eligible as well. Over 275 families have received pack and plays and education to date. 57% of the cribs have been distributed to families in an infant mortality hotspot that I just discussed in the previous slide. The Ohio Infant Mortality Reduction Initiative is a component of the Child and Family Health Services program at the Ohio Department of Health. Certified community health workers provide in-home family-centered care, coordination and education services to pregnant and/or parenting women with children up to 2 years of age. The eligibility requirements are African American pregnant women residing in the following zip codes that are listed on this slide. My Baby and Me, a Healthy Start initiative funded through the U.S. Department of Health and Human Services. This program provides in-home family-centered care coordination and education services for pregnant women, parenting women, and families with children up to 2 years of age. The eligibility requirements: resident of Franklin County, there's no zip code restrictions, pregnant or a parent of a child from birth to age 24 months. The Pregnancy Support Program is funded through the Community Development Block Grant. The program offers in-home, family-centered care coordination and education services to pregnant women and parenting women with infants up to 1 year of age. And these eligibility requirements are a woman that is pregnant and a resident within the city of Columbus. In terms of access to care, there are three things to consider about access to health care. It should be available, it should be appropriate, and it should be affordable. There are many factors that contribute to consumers accessing care: transportation, insurance, language, culture, self-efficacy. Access to care is a very relevant issue that requires our continued monitoring and collective inputs. Even if we have great healthcare system in place, they will only be effective if people have the tools and resources to utilize them. With the Affordable Care Act, there are many opportunities to make a big impact. Columbus Public Health has been involved in many things to help with these issues. We've held events at community locations to help with insurance enrollment, to resolve issues with Medicaid, and to convene leaders in some of the minority communities. In addition, we have regular hours for CPH clients to get the help with all of their insurance needs. And I've been asking this question all month, so what is April? April is Minority Health Month. And so in 1989, the Ohio Commission on Minority Health developed the concept of a high visibility campaign that you just touched upon earlier. The Office of Minority Health has the role of working with all of the commission-funded agencies to develop state and local Minority Health Month calendars. In celebration of Minority Health Month, program initiatives of the Office of Minority Health include the Statewide Expo, mental health community conversations for the African American community, cultural humility presentation, the Mexican consulate, and again, the policy systems and environmental capacity building trainings. So the question is, what can you do if you want more information or if you want to make a difference in our community? Well, become involved with the Office of Minority Health Advisory Committee. Become involved with the Community Health Advisory Committee. Visit our website for more information, www.publichealth.columbus.gov. So in closing, we've discussed the specific health disparities that exist in Columbus and Franklin County. We've talked about factors contributing to these health disparities, the social determinants of health. We've talked about specific initiatives and programming that will help to reduce these disparities. So again, for more information on Columbus Public Health, the Office of Minority Health, or any of the information that I've shared with you this evening, please feel free to contact me, again, Ryan E. Johnson, at 645-7335, or you can email me at rejohnson@columbus.gov. So again, I thank you for the opportunity to provide this information, and now I'm going to turn it over to Director Angela Dawson, who's going to talk about the Ohio Commission on Minority Health and the local conversations.
Good evening, Councilwoman Tyson and Councilman, that means microphone. Good evening, Councilwoman Tyson, Councilman Harden. Thank you again for the opportunity to come and share and for making the discussion of disparities a priority on your agenda. Certainly, the Ohio Commission on Minority Health, as Councilwoman Tyson shared, we were the first state agency in the nation that was specifically set aside to address health disparities and to examine the disparities between minority and non-minority populations. The commission was created specifically to address, eliminate health disparities within minority populations through innovative strategies, financial opportunities, public health promotion, legislative action, public policy, and system change. The commission accomplishes that core mission by providing state grants to community partners for initiatives such as disease prevention, the promotion of healthy lifestyles, the establishment of local offices, increasing access to local health care resources, and increasing the awareness of minority health disparities. So our priorities at the state level are to fund at the local level, to empower local level entities to address disparities. We have to pause and say thank you. We are unique in the nation. We are the only state in the nation that has local offices of minority health. You need to know that Columbus, a local office of minority health, is the most robust office because of your commitment and your investment in impacting disparities. This clearly shows that you see the connection between disparities and costs. In your packet this evening, I have included the Health Policy Institute of Ohio information regarding a health value dashboard for 2014. This document is the first of its kind in the nation. This provides a composite score of the value that Ohio is receiving for its investment in health care. Unfortunately, the information you have indicates that Ohio is ranked 47th out of 50th. This clearly shows that the work of the Columbus Local Office of Minority Health is on track, given that this report indicates that the top 3 health challenges for Ohio: adult smoking, infant mortality, and diabetes. So you can see clearly that the Columbus Local Office of Minority Health is aligned with state-level strategies as well as the national stakeholder strategy and the HHS Department of Action Plan to address health equity. So we, again, on behalf of the Commission, want to point out that we have made an investment in our local offices of minority health. We have 6 across the state, and we have made a $2.5 million investment to date in this office. It's clear that you all are matching that investment, and we certainly appreciate that support. One of the efforts that we have had in the local office of minority health, as well as all across the state of Ohio, is the Health and Human Services initiative around the local conversations. One of the efforts of the U.S. Department of Health and Human Services was to listen to the individuals in our communities to find out what the people are saying about health disparities. One of these efforts is our local conversations. We conducted 18 local conversations throughout the state of Ohio. All of our local offices of minority health participated in this endeavor. This allowed the community input to what the citizens' priorities would be to address health disparities. This document was released in conjunction with our 25th anniversary in 2011. We are initiating funding in fiscal year 16 to do the 5-year update. So the local conversation is actually our mechanism to continue, as always, to reach out to the citizens who are affected by disparities and hear their voice. Too often, policymakers change policy, implement policy and funding without the input of the citizenry. And so you can see by Mr. Johnson's presentation that beyond a shadow of a doubt, the local Office of Minority Health, which is supported by Columbus Health Department, is clearly on the track of listening to what the people say. An example of this, I've attended a local Office of Minority Health Advisory Committee meeting on the coldest day in the winter. Everyone was shut down. You need to know that Mr. Johnson had over 35 individuals in attendance at the meeting, clearly showing the commitment of that community-based advisory group, knowing that Personal comfort does not triumph over addressing the issues of disparity. So we know that the local offices have been put in place to serve as a mechanism to monitor health status, to inform, educate, and empower people, to mobilize community partnerships and community action, and develop policies and plans to support health efforts. So certainly on behalf of the Commission on Minority Health, I am always honored to sit at the left hand of Mr. Ryan Johnson, who is outstanding and committed along with all of his staff. We are able to support this office and provide a portion of funding to this effort. The commitment at Columbus Public Health was in existence before our funding began. It continues and it expands and it grows. So we are grateful to partner with you and would certainly entertain the opportunity on any future collaborations. Thank you.
Thank you, Director Dawson, and I want to say thank you to Ryan. I just have a few questions that around this report. So on page 7, where we're focused on really the health concerns of our community, and I'm glad that Director Dawson shared the kind of the dashboard, because I know it was the article in the newspaper about where we were in terms of being about number 47 in terms of healthcare. But my question really goes to, and I think that we're doing a lot of work in this regard, but we just talked about the unequal rates of chronic disease and the health behaviors, and you shared that, smoking and tobacco use, obesity, diabetes, asthma, and high blood pressure. And so I would just want you to share a little bit more about what we're doing at the health department in regard to those disparities. And I also know that we have partners in the nonprofit world that also kind of are helping on that. So could you just share a little bit with me about what we're doing with our community in regards to those numbers and the health department is doing?
One of the things that, one of the things that we've done is we've partnered with our strategic nursing team to provide blood pressure and blood sugar checks, especially during Minority Health Month. And so we were really excited to get that partnership established. One of the requirements from the Commission on Minority Health was to work internally with our individuals that provide screenings to do that during Minority Health Month. And so we're going to take it a step further. We're going to continue that partnership. Jane Dixon runs our strategic nursing team, and one of the visions that I have is to continue the partnership. So when we have what's called community education linkages and screenings, or CECL events. They're community events that our Office of Minority Health participates in. We're going to be working with the strategic nursing team so that they are hand in hand. So when we go out to these community events, we're able to provide screening and resources to individuals that can't.
Thank you. And the reason I'm asking those questions is because I know that we're doing a lot of work. And I know that, and in your presentation, you're sharing certainly the health concerns, but I also know that as a whole, Columbus Public Health is very much focused in these areas. And so I know that we have even if you're thinking about obesity and diabetes, I know we have the art walks, we have Walk with a Doc, that we have but we also have in the summer, we have the farmers market, so we have healthy food is there. And so I know that there is a lot going on within the whole department, and not department, but the Department of Public Health. And so I just wanted you just to share more information that may not just be in your area, but certainly as a whole, what Columbus Public Health is doing. And that's why I asked you those questions. And tell me a little bit about the local health advisory committees and what's discussed during those meetings, And if you are also sharing, I mean, I know the community's probably sharing their health concerns. And so just how do we address those concerns?
So the local health advisory committees. Well, first, we used to meet only on a quarterly basis, but we've been so inundated and busy that we decided to have these meetings every other month. And so the first thing I'd like to touch upon, it all started back in July when we tried to go after a grant to expand the capacity and the work of the Office of Minority Health. And one of the problems that we ran into with the advisory committee is the disconnect between direct service and policy system and environmental change in the language that it takes to go after CDC federal funding. It was a lesson learned. And so as a result of that, we learned and had conversations with our advisory committee members. How do we equip them with the necessary tools to help us so when a grant opportunity rolls around again, we'll be ready to roll? And so, again, lessons learned, fast forward to where we are today. We've contracted with Confluence Unlimited, and we've hosted policy system and environmental trainings with our advisory committee partners. And again, those partners, we have over 40 partners that are a part of our Minority Health Advisory Committee. To have that discussion, what does it mean to do policy system and environmental change? How is that impacting your work, and how can we further the mission of the Office of Minority Health and the things that we do? And so that's one aspect. The other aspect from the advisory committee is that they wanted to know what other agencies were doing and how they could equip resources and programs. So during every meeting that we have what's called a learning session. So it's an opportunity for advisory committee members to share some of the work that they're doing, to identify what are some of your deficiencies, and also to network with the other advisory committee members in addressing racial and ethnic disparities. And so those are some of the things that we have been doing with our Minority Health Advisory Committee or Council. Again, we're starting to meet on a bi-monthly basis, and we're really excited. Again, our last policy system and environmental training is scheduled for this Thursday, and we'll be moving forward and implementing some of those ideas generated from that, so that when the next CDC funding arises, we should be in a better position to try to get some additional dollars to do the wonderful things that we do.
Thank you. And then we look at the unequal rates of infectious disease, and certainly those numbers are just, I can't think of the word really to use. I mean, those numbers are just are astronomical. But I also know that we have Ryan White money that's in this community. We just passed legislation on all this yesterday to deal with individuals with HIV and AIDS. And so we know that it is an issue in our community. And so we have those dollars to do, I know there's prevention and care, to work with a number of different organizations. And so I know that we are dealing with that issue in our community with those dollars. And certainly, is there anything that we're doing anymore with the African American community? Because we know those numbers are so high and in that community.
Well, in addition to expanding our outreach as far as testing, one of the things that the Office of Minority Health has done is we've partnered with the West Side Community Health Advisory Committee to host community conversations on mental health. And we've conducted 2 of those conversations, and there's actually one scheduled for this Saturday. So we're going to be pretty busy this Saturday with the African American community conversations on the West Side, the Mexican consulate event at the health department, and then I'll be participating in the Asian health and wellness event in Upper Arlington. So in addition of that, and then we also have a new staff member on board with us that's, I think I shared with you, that started this past Monday. We have a training called Consumer Empowerment, and that's basically, in a nutshell, how to talk to your doctor or healthcare provider when you go to a facility or clinic. And so we're going to be starting to implement those consumer empowerment trainings in some of the African American congregations, and I'm really excited about that. We'll also be working with our Healthy Neighborhood social work team to expand those efforts in some of the areas that they've been a part of as well. So.
I know we've had some campaigns too in regards to HIV/AIDS. I know we've had the Take Care Down There campaign. And so obviously that maybe and I'm not expecting you to have every answer right now. We're just sharing the information, but it's bringing to light what some of the issues are in our community. And I certainly know that we as a council will certainly want to be your partner in trying to help with some of these health concerns that we have in our community, to try to make sure that not only we're asking what Columbus Public Health is doing, but also we know we fund the Columbus Neighborhood Health Centers. How can they help us? We also fund nonprofit organizations. I think the president of Central Ohio Diabetes in this room today, and I think that it's just about what you're doing is providing us with this information. And so as we're listening, we'll be able to think about, as we're providing dollars to organizations, that we're asking, are they focusing on the areas that we know in our city that you have told this committee that these are the areas that we are having unequal rates of illnesses in our community, and how can we help as we're funding those other organizations to say, now, are you also focusing on these areas? And so we appreciate that you're giving us this, informing us of this information. And that same goes with the health concerns of, equal rates of mortality, that thinking about, again, diabetes, homicide. I know the work that's going on with the APPS program, but there's lots that you're working with the Councilmember Harden, especially around, all the initiatives around the African American males, because homicide, as you said, is a concern. So it does go into all the other committees that we have here, and how we have to work together as we know the information, and that's how we'll be better to fund those organizations. And so, and then of course, I think that because of the unequal rates of poor birth outcomes, we see now that the emphasis of dealing with infant mortality in this community, and just appreciate the efforts that the Columbus Public Health Department is doing, working with this council, working with the mayor, working with the private sector to be able to deal with this particular issue. So I just appreciate you bringing this information to us. And hopefully, as long as I'm here every year, that we're going to have this discussion, and hopefully we can see that we're doing more and more around these areas, and we're collaborating with these other organizations to make a difference in these numbers, because that's why I want to hear these numbers. And when you hear it, it means we have to do something about it. So I appreciate the work that you're already doing, and I know that you're doing probably a whole lot. I can't think of every single thing you guys are doing at Columbus Public Health. I'm just naming some of the things that I know that you're doing. And so I'm hoping that in the future, that as you do this presentation, that you are adding all those other initiatives that are going on within all those other departments, even though they may not fall directly under you. But again, I know what you're doing over there, and I do appreciate that. Councilmember Harden, do you want to make any comments?
Thank you, Chair Tyson. I want to applaud you for hosting this very important hearing and taking the time to recognize Minority Health Month this April. I learned a lot today in the hearing. I want to thank Director Dawson, Mr. Johnson, Nancy Becklow for being here and presenting this information. It was a lot of information, and I know sometimes when we're talking about minority communities, one of the barriers is getting that information to the actual community. And so the only question, or something that I was interested in, is what are the steps that we're taking to make sure that we're getting these opportunities to the community. And I'm really excited about the work that you guys do with the African American wellness walk, but also just thinking about the LGBT community and youth. I think we have to think of alternative ways to reach these populations. If the young folks are in the clubs, then we need to be at the clubs because these issues are so important to minority health. So that's my only comment. I want to thank you guys, and I would love to hear a little bit. And I apologize, I'm going to have to run in a few minutes, but I thank Councilmember Tyson, Chair Tyson, for inviting me here and hosting this important conversation.
want to respond to that question about what we're doing?
Yes, yes, ma'am. It's simple. Visibility in the community. And so one of the reasons why we have our community forums is because that was something that came out of the local conversations. Again, we did the local conversations that was focused on resources, services, capacity, and infrastructure, and how we can make a difference. And one of the responses was to have monthly topics on different health education topics based on what the people wanted. And so Hebu Nord, Jesus Avaye, and now Lindsay Lachey will be helping me to identify these community groups and the different topics. Where do we need to go? What topics do we need to identify? Now, obviously, some topics are going to be sort of like your Ebola, the hot topics that come out of the health department, your Ebola, infant mortality, things of that nature. But the topics from community groups are what we sort of focus on with those community conversations. And so, again, so it's engaging with those community forums. It's also working with the advisory committees and asking them, where is it that we need to go? What is it that we need to discuss? And so those are the two particular venues. And then the third piece, and the one that to me is the most fun, is engaging in some of the community education linkages and screenings, or the health events. Participating in the neighborhood prides. Obviously, I think there are, 4 or 5 prides for this year. So being able to participate in those prides and listening to some of the residents and letting them know that the Office of Minority Health is here to serve the community and the people.
Thank you. Thank you, Councilmember. The only other question I'm going to want to ask about is just, I know it's not part of the presentation, but in terms of the issues around the health concerns, but certainly you have in your presentation the topic of discussion of coping with substance abuse and mental health. And can you just really share a little information regarding in those presentations, what are you hearing? What are we doing around the issue of substance abuse and mental health?
Simple. Stigma. And the stigma affiliated with individuals not getting the help that they need. And so, number one. And number two, where to go? If I have a child that's suffering from this condition, where is it that they would go? And is there a healthcare or service provider that looks like me and is going to help me to get to where it is that I need to be? Those are some of the things that have come out on that. And that's why we've hosted different ones, is to try to pull out some of those. And we've had those different conversations. And that's why we wanted to partner with the Westside Community Health Advisory Committee, because, again, that was a topic that came out of the local conversations, and it all stemmed from us talking about that we wanted to do community conversations and we were looking for topic ideas. And so that was actually an initiative that was spearheaded with the Community Health Advisory Committee with our help and support.
And can you share, Ryan or Nancy, of the programs that you have at the health department that are in regards to certainly substance abuse?
Well, we have an alcohol and drug program, but I am going to divert to Nancy, who can share a little bit about that.
Thank you.
Thank you. Thank you, Councilwoman Tyson. So we do have an alcohol and drug program, and it is both a treatment counseling program for people who are trying not to use, and we also have prevention programs that are out in the community and out in the schools. We do partner with Adam H. in a lot of our work so that we make sure that we're pulling in programs and partners that are more widespread in the community. You did mention the APPS program, which we're very active in. We also now are working with some of the hospital systems and the AIDS Resource Center about looking at a harm reduction program possibly for the city, and that would entail several components: a needle exchange, a naloxone program. So we're looking at what else might be possible here for our residents who need these services.
Well, first of all, I want to say thank you to Ryan and Director Dawson and to Ms. Bechtel for being here today, as well as the whole team from Columbus Public Health that's in this room today. and just really appreciate each and every one of you for what you do for our city, for our residents, to provide, to give everyone an opportunity to be able to have the same health care for every individual. I know you're working hard to make that happen. The question I'm going to ask you, though, is what's your biggest barrier that your office faces in terms of promoting the health, wellness, prevention, and active lifestyle in terms of our minority communities? Because a lot of that is why we're having some of the issues that you talked about today. And so what's your biggest obstacle for you being able to do the work that you would do each and every day?
That's actually a great question. I guess my answer would be, how do we change the mindset and misinformation of specific racial and ethnic minority populations? One of the things that comes to mind with me is dealing with the Somali population and the misconception of the population and autism. And so, again, that's why we have those community conversations. So that's getting at what it is that Columbus Public Health is doing. The other one is dealing with the partnership that I've had with working with our LGBTQ community group, and that's the expanding the definition of what it means to be minority. And our role is in trying to do everything as far as our programming and ensuring that is fully inclusive of every racial and ethnic minority population group. And so, again, what does that mean to be minority, and how do we get that information across to the different population groups that we're working with? So those two particular things, I think, would be, the biggest barrier. But I'm also excited. Again, we have a new staff person on board. We have a lot of ideas that we're going to spring forward with, especially coming out of the policy systems and environmental changes. And again, I would just like to say thank you to you for supporting the Office of Minority Health and Columbus Public Health and all the wonderful things that we do.
Well, I thank you, and I think that we have to work together from the state, the city, the nonprofit organizations, because if you think about, when I read this article in the paper and now look at this dashboard, there are some areas that we know that we just have to try to continue to focus on together. And as I'm thinking about health and human services and how we fund organizations, I've got to be like laser-like in thinking about where do we want to be with adult smoking. If you're looking at these issues, adult diabetes, infant mortality, we already now know where we want to be, and we're working towards that. But I think, we need to think about, what are our goals? Where are we trying to go? Since the state has the same issues that we have, we're the largest city in the state, and we certainly have those same problems. But how do we begin to decrease those numbers? I think we're focusing a lot on prevention, which is great. But what do we need to do? And so I'm going to look to you. I know we're doing a lot already, but I also want to look to you from the state and from our local government to say, what else should we be doing to be able to reduce these numbers and these issues? So because once you know information, that means you have a responsibility to do something about it. And so that's what I would like to be partnering with you to make that happen. I really like that you're having those conversations, because you always have to hear from the people. And hopefully, I'd like to also know what the people are saying that are their health concerns, because it may not be, maybe they're similar to these, or maybe there are others. And how do we help to address some of those concerns? So I do truly appreciate you coming and sharing. I appreciate the team. I'm so excited that we have the first Office of Minority Health, and that we have a robust department with the city of Columbus, the Columbus Health Department. That's all great news. And so we want to go from being, we're going to go from good to great. It's great news, but we want to even get better. And so how do we do that as a team working together? So I appreciate you coming and sharing, and this information this evening. I don't think we have any speaker slips, so I'm hoping that the viewing audience has benefited from this information that was shared. The prevalence of these diseases such as cardiovascular disease, HIV/AIDS, and diabetes in minority communities clearly demonstrates that there is much work to still be done around those to reduce those disparities. And but I don't want to say that we're not being hopeful, because I know that we're doing great work, and you've shared that. And so the next time we have this hearing, I know you're going to share even more about the whole department and the great things you guys are doing. And so again, I want to thank Ryan Johnson and Director Dawson for being here tonight, for having this discussion about those disparities and what we're doing to remove them. So I want to just say again, thank you. I look forward to us working together on reducing those disparities. And I want to thank the professionals at CTV who worked hard to prepare this broadcast, and so will allow the people who couldn't watch us today to hear this conversation and know the things that we're doing. I want to thank Tom Diamond from the City Council's Research Office, who works with my team. Thank Nicole and James, who are here, Nicole Harper and James Lewis, and also my fellow council members, who again have remarkable staff members that work with them and who work hard each day to make sure that we can provide work for our residents each and every day. But most importantly, I thank our residents of Columbus who make our city the best place to live, work, and to pray and to raise a family. And the last question I'm going to ask you, Ryan, for any of the programs that we've talked about today, if people want to get involved in it and for all the things that you're doing, can you again just share the information from Columbus Public Health, how they can reach your department?
Absolutely. They can just contact me and I can point them in the right direction. And again, my name is Ryan E. Johnson, Program Director for the Office of Minority Health. My email is rejohnson@columbus.gov, rejohnson@columbus.gov, and my telephone number is 645-7335.
Thank you for coming this evening. And lastly, I have one announcement I want to just share, that I just had a meeting with an organization called Melissa's House. And Melissa's House is an organization, it's a nonprofit organization that is committed to creating loving and welcoming living spaces for adults living with mental illness. And they collaborate with organizations to renew existing residences with enhancements that positively impact the well-being of those who live and work there. Creating a comfortable, nurturing environment advances healing and recovery while restoring hope. And so I just wanted to say that this is a great organization. They're focused on, we all want to be in a very beautiful space. And just had a really good discussion with the president of the organization, who lost her daughter based upon having mental health. And their way of giving back is to make sure that they're working with Columbus Housing Network, which is great, and their spaces to be able to make their the common space, for one, change the look at the common spaces so that they can continue to make sure that individuals who are suffering with mental illness are going to be in spaces that make them feel better about where they live and who they are. So I just want to share that information. And if you want to, they're asking people to join their team for the Cap City Half Marathon on May the 2nd. And if you would want to be a part of Melissa's House, then please contact www.melissashouse.org/donate. And so with that, I'm going to have a safe trip home. Thank you for being here, and I appreciate each and every one of you for the work that you do each and every day. Have a good evening.